Many people who need hip replacement surgery put it off as long as possible because it means losing the ability to be physically active. It means saying goodbye to sports they love, like running or skiing. Well, now there's a breakthrough in hip surgery with a new process that doesn't involve hip replacement, but rather hip resurfacing. Joining me now with details is Dr. Sharat Kusuma with the Bone and Joint Center at Ohio Health Grant Medical Center, along with Scott Searing, who has undergone the surgery. And welcome to both of you.
Thanks for having us.
Nice to see you again, Doctor. I visited your practice a few years ago.
I remember.
Since then, you're doing more and more.
Before
we get to what the explanation is, who's a candidate for something like that?
So in the last 4 years since we've last met, we really honed down the best candidates are gentlemen like Scott, who are young, active males who previously have not done as well with regular hip replacement. So if you talk about the ideal candidate, it's a young male under 55 years old who's in good health and active, and the data worldwide shows that those patients will do better with a hip resurfacing than a regular total hip.
Is it usually arthritis that is causing this issue?
Usually it is arthritis, and you'd be surprised how many young active males have debilitating arthritis, and you know, Scott will share with us that his experience, but usually arthritis, yes.
So Scott, you had it not once but twice?
And in both hips. It was painful.
It's painful in both hips, and now no pain?
And no pain at all. I mean, it's amazing. I went from basically 3 years ago or so, just getting around, being in pain at the end of the day, and I was surfing just last night, or 2 days ago, back down in Florida, and no pain at all.
Amazing, amazing. How did you hear about Dr. Kusuma?
Our local doctor down there, when I went in to see him, I said, "Doc, I'm at the time 34 years old, what am I supposed to do?" And he mentioned this procedure, and then he also mentioned Dr. Kusuma. I did my research, you want to find a good doctor, and so I flew up here to get it done.
Well, Dr. Kusuma, what many people may not realize is that this, called the Birmingham resurfacing, is not done by very many folks around the nation. You're one of the few.
Right. Well, the reason for that is because it's relatively new to this country. It actually was developed in England in the mid-90s, but we did not get FDA approval in the United States till 2006. So they had a big head start in Australia and Canada and England. So there are not many surgeons in the United States who have had the chance to learn this, but I hope they will, because, you know, for a 34-year-old guy, having a traditional total hip replacement is really not, I think you'd agree.
Yeah, that would really limit your mobility.
Not a great option, but
it's not experimental. We want to make sure folks
No, absolutely. You know, again, we have 17-year data now on young, active gentlemen like himself who have been doing skiing and karate and, you know, you name it, and with excellent survivorship and longevity, so nothing experimental about it at all.
And this is video of one of your other patients, an older woman, so really age doesn't matter when it comes to
Yeah, it's not as much age. Like I said, the ideal candidate's what I talked to you about earlier, but really if a patient's healthy, has good bone quality, and is active, you can stretch the indications and get very good results as well. So
you brought some models. Let's show folks how it works.
Let's do a 2-second demo here, and this model, I think model's worth 1,000 words. So a traditional total hip, as many of you guys have seen, this is a thigh bone, which would sit basically right here on my leg, and you can see with a normal total hip what we do is we cut off the big ball part and put a large spike that hopefully you can see the acrylic femoral model.
Pretty invasive.
Right. So on the socket, what we do with a regular hip is we kind of use a cheese grater and remount the bad bone, and then we put a plastic liner. Well, traditionally the problem has been that this plastic liner, for a guy who's 34 years old who's going to surf and do other crazy things that 34-year-olds do, will wear out. A resurfacing is fairly dramatically different, and I'll have another acrylic model here to show you. And I actually brought an actual implant that you can look at if you want. But on the femoral side, or on the thigh bone, again, if this is my left femur, you can see the difference. Instead of cutting off the...
Hold that up a little bit here, Doctor. There you go.
So instead of cutting off the ball and putting a big spike down, we're simply just capping, like you put a cap on a tooth, let's say.
Yeah.
Instead of replacing the whole tooth, you just put a cap on the part that's arthritic. And the beauty of it is, you can see, number one, the ball head is the same size as the patient's native ball head. So anatomically, it feels very much like a natural hip, but also it allows greater range of motion, and of course they can do high-impact sports on it. Then on the socket, instead of using a plastic, we're using a metal socket that goes in the pelvis, and so you can see this is much more bone conserving, significantly more bone conserving than a traditional total hip for a patient.
And somebody like Scott, you're smiling, you're surfing, you're doing everything you need. And
it's amazing, yeah. I mean, when I first got the results back from x-rays years ago, I'm like, what are you talking about? This can't be happening. And then I never expected this, right?
Well, we are so glad that you have your life back and you're surfing. Good for you. Dr. Kusuma, it's a pleasure to have you here.
Thank
and
you.
we've had information on screen, so I'm sure there are folks out there very interested in you can make their life a lot better.
Hopefully, and like I say, hopefully the word will get around about how this is definitely a better option for younger males like Scott. So,
thank you both.
Well, thanks for having us. I appreciate it.
Sure.
Thank you.